Okay, welcome back to part 4. We're working on the topoisomerase inhibitors. So topo 1 inhibitors, such as topotecan and irinotecan, and topo 2 inhibitors, such as etoposide and teniposide. Both of these are very important. Let's work through these. So first, topoisomerase 1 inhibitors, cell cycle specific drugs. They inhibit proper DNA function in the S phase, and they prevent DNA replication. Mechanism of action: levels are increased during the whole cell cycle, topo 1 inhibition. Side effects: diarrhea, reversible myelosuppression, relatively low toxicity. Indications: metastatic ovarian tumors in case of first-line therapy. And then for colorectal cancer in progress, then you would use irinotecan. Next one, etoposide. These are topo 2 inhibitors. Can you remember that? MOA, topo 2 inhibition. Side effects: nausea, vomiting, myelosuppression, alopecia. Indications for solid tumors: lung, small cell lung cancer, testicular, trophoblast, ovarial, urinary bladder. Malignant lymphomas, acute non-lymphatic leukemia. Okay, next section, hormones: glucocorticoids, prednisolone and dexamethasone, and antihormones such as tamoxifen and flutamide. So first, tamoxifen. Mechanism of action: nonsteroidal antiestrogen, inhibits estradiol binding to receptors. Indications: by mouth application in breast cancer with positive estrogen receptors. Side effects: vaginal bleeding, thrombophlebitis, flush, alopecia, endometrial effect. So we didn't cover all of them, obviously, so I'm going to have to go to Lang to catch the rest, but we're now moving on to the 8th section, 8 of 9, enzymes and other chemotherapeutics. Enzymes, most important here is Asparaginase, and we'll talk about other chemotherapeutics, procarbazine and hydroxyurea. First, Asparaginase enzyme. MOA, kinetics, indications: cleaves asparagine, useful in malignancies where the cells have lost the possibility of synthesis, given by in IM, IV, in ALL. Side effects: weak myelosuppression, GI toxicity and alopecia, nausea, vomiting, CNS depression, anaphylaxis, hepatotoxicity. 8. Tyrosine kinase inhibitors. So this is imatinib, mesylate, and the mechanism of action, kinetics and indications here. So tyrosine kinase inhibition, given by mouth for therapy of CML and GIST. Side effects: nausea, vomiting, diarrhea, edema, headache, muscle pain, neutropenia, and thrombocytopenia. And number 9, monoclonal antibodies, rituximab and trastuzumab. So first, rituximab, monoclonal antibody only for IV application, indicated in lymphoma therapy. Next, trastuzumab, monoclonal antibody only for IV application, indicated in HER2 neuropositive breast cancer therapy. Side effects: pseudoinfluenza, fever, headache, chest, abdominal, muscle and joint pain, nausea, vomiting, diarrhea, and exanthema. So then we just have the summaries. I'm not going to go over these, but these are from Katzung, and you can see some nice summaries in here. And that's basically what we're going to talk about today, and that's the end of our lecture. Thank you.